A very good evening to all of you. Today, we are going to do the Pharmacology MCQ challenge. This subject is very important as far as the NEET PG and INICT is concerned. So, most of the questions are from pharmacology. Some of the questions in medicine can also be answered from the background and solid foundation in pharmacology. Some questions in pediatrics and PSM can also be answered. So, let us begin with usually the questions are like this: drug of choice, side effects. All of the following are the side effects, except sometimes they give you an image and they will ask you this condition is caused by this condition is a side effect of which drug. So in this way the questions are asked. So let's move on to the first question. Clinical effect of vitamin D is reduced by A. Simultaneous ingestion of phytates. B. Simultaneous ingestion of lactose. C. Acidic environment. D. None. C. The main clinical effect of vitamin D is to enhance the intestinal absorption of calcium. With an average intake of 1000 milligram of calcium, its net intestinal absorption is only 150 to 250 milligram per day. Calcium is absorbed mainly in the duodenum and jejunum, proximal intestine, by an active transport mechanism which is regulated by 125 OH2D, that is calcitriol. Parathormone indirectly promotes the absorption of calcium by increasing the renal synthesis of 125 OH2D3. Dietary lactose, proteins, and an acidic environment promote the calcium absorption. On the other hand, phytates, phosphates, oxalates, tetracycline, and alkaline environment impair the calcium absorption. So the correct answer here is simultaneous ingestion of phytates. So it is A. Which of the following is a drawback of extended release? Drawback of extended release preparation. A. Frequent side effects, high peak side effects, decreased compliance. C. Increased cost. Extended release drugs are associated with gradual rise in drug plasma concentration that is maintained throughout the day, thus avoiding the peaks of high and troughs of low plasma concentration. By delaying drug action, the number of doses required considerably decreases and hence compliance increases. Compliance increases. Though the cost is higher than the normal preparation drugs, extended release drugs, if taken with food, more amount of drug can be released, that is dose dumping, which can cause toxicity. So the correct answer here is C, increased cost. Which of the following drug toxicity can be seen in Crigler-Najjar syndrome? A. Tenofovir. B. Zidovudine. C. Atazanavir. D. Nevirapine. The drugs with established toxicity in case of Crigler-Najjar syndrome are, remember this, irinotecan and atazanavir. These drugs are metabolized by glucuronidation. That is irinotecan and atazanavir. So from the options you can see atazanavir is option C. So the correct answer here is atazanavir. C. Now let's move to the next question. An acidic drug is maximally absorbed from A. Stomach, B. Small intestine, C. Large intestine, D. Oral cavity. An acidic drug is maximally anionized in the stomach. An acidic drug is maximally anionized in the stomach. But as it has a thick mucosa and small surface area, maximum absorption takes place in the small intestine. So the correct answer here is B. Small intestine. Which of the following is the fastest acting receptor? A. Beta 1, B. M2, C. GABA A, D. Estrogen receptor. Ligand gate and ion channels are the fastest acting receptors. The only ion channel receptor in the given option is GABA A. So the correct answer here is C. GABA A. Anandamide is A. Opioid, B. CK1 antagonist, C. D2 blocker, D. Cannabinoid neurotransmitter. So what do you think is the correct answer here? Anandamide. See, anandamide is also known as N-arachidonic ethanolamine or AEA. It is an endogenous cannabinoid neurotransmitter. The name is taken from the Sanskrit word ananda, which means bliss, delight, and amide. It is synthesized from N-arachidonyl phosphatidyl ethanolamine by multiple pathways. It is degraded primarily by fatty acid amide hydrolase FAAH enzyme, which converts anandamide into ethanolamine and arachidonic acid. As such, inhibitor of FAAH lead to elevated anandamide level and are being pursued for therapeutic use. So the correct answer here is D, cannabinoid neurotransmitter. The drug in delivery system given below is A, topical use, B, systemic use, both topical and systemic use, D, none. It is a transdermal patch. You can see the route is systemic use. So the correct answer here is B, systemic use. Which of the following drug is preferred in WHO stage 4 for the condition given in the picture? See, here in the picture in the X-ray, you can see prominent pulmonary arteries in the X-ray, and it is consistent with the diagnosis of pulmonary arterial hypertension, that is stage 4 pulmonary arterial hypertension, and the drug of choice is epoprostenol. So the four options are A. Bosentan, B. Sildenafil, C. Epoprostenol, and D. Nifedipine. So the correct answer here is epoprostenol, that is C. Acidic drugs bind to A. Albumin, B. Alpha-1 glycoprotein, C. A. Globulin, B. Alpha-1 glycoprotein, C. Albumin, D. None. Now, the acidic drug binds to albumin. Acidic drug is best absorbed in the stomach. Acidic drug is ionized in the intestine. Acid drug excreted quickly in the alkaline urine. Basic drug binds to alpha-1 glycoprotein, best absorbed in the intestine. Basic drug is ionized in the stomach, excreted quickly in acidic urine. Many natural substances circulate around the body, partly free in plasma water and partly bound to plasma protein. Example, cortisol, thyroxine. Similarly, drugs circulate in protein bound and free states, and the significance is that free fraction is pharmacologically active, whereas the protein bound component is reservoir of drug that is inactive because of its binding. Acidic drugs generally bind to plasma albumin. Basic drugs bind to acid glycoprotein. So the correct answer here is C. Albumin. Acidic drugs bind to albumin. The drug in the picture is used for C. The picture is pill 72 levonorgestrel tablet used for A. Breast cancer, B. Routine contraception, C. Emergency contraception, D. Abortion. Two tablets of levonorgestrel are given in the picture are used. They are 12 hours apart for emergency contraception. So the correct option here is C. Emergency contraception. Sugamdex is used for. Sugamdex is a novel reversing agent. The four options are organophosphate poisoning, B. Reversal of neuromuscular blocker, C. Treatment of local anesthetic poisoning, D. Treatment of central anticholinergic syndrome. Sugamdex is a novel reversing agent developed for terminating the action of non-depolarizing muscle relaxant, rocuronium and vecuronium. It is a modified Y-cyclodextrin with high affinity for rocuronium and vecuronium. It encapsulates one molecule of NM blocker within its molecule, forming an inactive chelate which is excreted in urine. So the correct answer here is B, reversal of neuromuscular blocker. Mode of excretion of cyclophosphamide is A. Lung, B. Liver, C. Kidney, D. Skin. Cyclophosphamide is primarily metabolized 80% and metabolites are excreted in urine. 10 to 20% is excreted unchanged in urine and 4% is excreted in bile. So the correct answer here is C. Kidney. Please click the link in the description box to join the 2-day Ultimate Neet PG Breakthrough event. It covers all the 19 subjects in a holistic manner in the shortest possible time. and it will give you a boost to your revision. The more you revise properly, see, most of the time is we don't utilize properly. We revise something else, so it will channelize your revision process. The first 10 people who click the link in the description box will get this masterclass absolutely free. What is the type of receptor given in the picture? A. GPCR, B. Ion channel receptor, C. Enzyme link receptor, D. Nuclear receptor. The pentameric structure in the picture is a nicotinic receptor. It is made up of 2 alpha, 1 beta, and 1 delta subunit. See the image carefully. So the correct answer here is it is a ion channel receptor. Duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability, D. All. It is all. Which of the following drug can cause thyroid dysfunction? A. Amiodarone, B. Ampicillin, C. Abutolite, D. Acyclovir. The drugs causing hypothyroidism are lithium, sulfonamide, phenobarbital, phenytoin, amiodarone, para-aminosalicylate acid, pass, rifampicin, carbamazepine. So the correct answer here is A. Amiodarone. Which of the following anti-migraine drug might have caused a side effect in the picture? Ergotamine can cause severe peripheral vasoconstriction and gangrene in organs with end arteries like finger. So the correct answer here is D. Ergotamine. Dopamine, all of the following is true. Causes increase in GI ischemia, positive inotropic, improves renal perfusion, causes vasoconstriction, except causes increase in GI ischemia. The side effects of digitalis are all except A. Ventricular tachycardia, vasodilatation, nausea and vomiting, ventricular bigeminy. Digitalis causes mild vasoconstriction, not vasodilatation. So correct option here is B. Antiandrogen used in heart failure, carvedilol, B. Sampretrelat, spironolactone, abiraterone. The correct answer here is C. Spironolactone. Spironolactone and eplerenone are aldosterone antagonists. They are used as potassium-sparing diuretics. Their diuretic effect is quite feeble, but in congestive heart failure, these drugs reduce the mortality. So the correct answer here is spironolactone. Which of the following drugs might have caused a side effect given in the picture? A. Antacid, B. Bismuth, C. Cisapride, D. Sucralfate. It is bismuth. Gemcitabine is used mainly in which cancer? A. Colorectal, B. Breast, C. Pancreatic, D. Craniopharyngioma. It is pancreatic. Maximum liver toxicity is seen with which antibiotic drug? Isoniazid, rifampicin, pyrazinamide, streptomycin. It is pyrazinamide. Fastest acting antithyroid drug are A. Iodides of NaK, propylthiouracil, methimazole nitrate. The iodides of Na, iodine, and iodide is the fastest acting thyroid inhibitor. Most important action is inhibition of hormone release. Thus, but all the facets of thyroid synthesis may be affected. Excess iodide inhibits bone transport in the thyroid cell and may alter the redox potential of cell, thus interfering with iodinization. That is, iodination is reduced. So the correct answer here is A. Natalizumab is used in the treatment of A. Multiple sclerosis, B. Breast carcinoma, C. Psoriasis, B. Cell lymphoma. It is multiple sclerosis. Special feature of Glargine insulin is it produces a smooth peakless effect. It is not suitable for once it produces. See, Glargine insulin is a long-acting biosynthetic insulin. It remains soluble at pH 4 of the formulation and precipitates at neutral pH on subcutaneous administration. Onset of action is delayed. It produces a smooth peakless effect. It is suitable for once daily administration. It does not control mealtime hyperglycemia. So the correct answer here is special feature is that it produces a smooth peakless effect. Smooth peakless effect. So the correct answer here is smooth peakless effect. Mechanism of action of Tylostane is A 11 beta hydroxy inhibitor, B 1 alpha hydroxylase inhibitor, C. 3 beta hydroxysteroid dehydrogenase inhibitor. D. 7 alpha hydrolase inhibitor. It is 3 beta hydroxysteroid dehydrogenase inhibitor. Treatment of choice for cheese reaction is A. Prazosin, B. Pentazocine, C. Phentolamine, and D. Phenoxybenzoamine. Let us look what is cheese reaction. Certain varieties of cheese, beer, wines, picked meat, and fish and yeast extract contain large quantities of tyramine. In MAO-inhibited patients, these indirectly acting sympathomimetic amines escape degradation in the intestinal wall and liver, reaching into systemic circulation. They displace large amounts of noradrenaline from adrenergic nerve endings, which leads to hypertensive crisis cerebrovascular accident. This can be treated by IV injection of rapidly acting phentolamine. So, prazosin and chlorpromazine are alternative. So, the treatment of choice is phentolamine. Essential drugs. Essential drugs A included in the pharmacopoeia. B should always be present at PSC. Those that satisfy the primary healthcare needs of population, life-saving medications. It is those that satisfy the primary healthcare needs of population. Post-marketing surveillance included in which phase of drugs clinical trial? It is in phase 4. Which of the following is most active against slowly dividing tubercle bacilli? Isoniazid, rifampicin, streptomycin, ethambutol. It is rifampicin. Drug contraindicated in G6PD deficiency is A. Chloroquine, primaquine, quinine, all. Yes, all of them are contraindicated. Which of the following anti-cancer drugs are competitive inhibitor of tyrosine kinase? They are imatinib and sunitinib. Which of the following drugs might have caused the side effect and given in the picture? It is insulin. What is it? Lipohypertrophy at the site of injection due to inhibition of lipolysis, and it is seen with insulin. Ranibizumab is a monoclonal antibody against A. IL-6, B. CD20, C. VEGF, D. EGFR. It is VEGF.